Alex. I'm a practicum student at Psychology Houston. As you've watched in the previous videos, we've been talking about the comb model for the treatment of trichotillomania or hair pulling. And the comb model was developed by Dr. Charles Mansueto and his colleagues at the Behavioral Therapy Center of Greater Washington. In the video, the SCAMP model has been discussed, and as you've learned so far, S stands for sensory, C for cognitive, A for affective, M for motor, and now I'll talk about P, which stands for place. Place refers to environmental cues such as settings, people, and activities, and particular objects such as mirrors and tweezers that are associated with hair pulling. It's important to evaluate where, when, and with whom and how pulling occurs to fully understand the contextual cues to address them with relevant interventions. So some common strategies to target place include removing or covering mirrors if the individual normally pulls in front of mirrors, setting a timer for how long an individual can be in the bathroom if that's a place they normally pull. Also, if somebody normally pulls in a certain room, a strategy may be for them to not go into that room or for them to place a sign on the wall that will make them more aware of their pulling in the room. And if somebody normally pulls in rooms when they're alone, then the individual can make sure to be in a room with somebody else whenever possible. And if somebody normally pulls while driving, one strategy may be for them to wear gloves or band-aids on their hands while driving to decrease their hair pulling. So additionally, if somebody normally pulls with tweezers, then tweezers can be thrown away or kept in a frozen ice tray so that when the person has to thaw the tweezers, this will allow them more time to use other interventions or strategies to discourage their hair pulling. So at Psychology Houston, the therapist and the client work together to determine the best interventions for the client to decrease their hair pulling.